Hello, everyone.
May just be us. Are there people on there? If not, I can just like show it to you. Well, all right, I'll try it.
Yeah. So I should also mention that Blue Jeans will be recording.
Okay, so I won't say anything untoward. Got to make sure.
Yes. So for
nothing off color.
Yes.
I know. It's a blessing that one forgets about that when you start talking. Otherwise, it's okay. Let me just.
But also only if that's okay with you. If you're okay with this. Okay.
So and it'll be connected to the presentation, so it can be used in the future.
That's great.
Yeah.
I'm going to skip some of the slides. I wrote down, like which ones I want to go through. So
okay.
Just FYI. Okay. Let me see what I need to put in here. Okay. I have them brought up here, and I have the. I didn't put a subject.
Okay.
I didn't.
Oh, yes, that's okay. Perfect. Thank you. So would you like me to pull all of them up?
Yeah, why don't you pull all of them up and then I can. So I can just start. I don't know, have I met you before? I have, but I don't remember your name.
Hannah. It's Hannah.
Hannah. Okay. That's nice. Okay. Before I start, I want to say that the information in these slides is about, well, first I'll say, the way I think about rapid analysis is there's kind of a spectrum about how rapid and how in-depth it is. So what's described here is I would say, the least in-depth version of rapid analysis. It's very quick summarizing. Okay, thanks, Sydney.
I don't think the sharing is on.
You don't. Thank you. Thanks for pointing it out.
Yes,
I wouldn't have known how to do it. Well, maybe I would, but it would take me a while. So it depends on the project, how in-depth. Oh, and Hannah, how much do you have qualitative research experience? Okay, this is fine because this is something that is good for people who don't. So, but in terms of qualitative analysis, you can do very quick surface kind of looking at what people say, or you can do a little bit more, a little more in depth. So I just want to point that out before I start talking, so we can think about for this project, for the particular project, what is the best approach. This is I'm going to talk about the generic kind of procedures you go through with rapid analysis, but it can be modified to be a little more in-depth than what is presented here. Okay? All right. So let me just, and I want to, this is obviously not my, I went all the way to the, okay. This is obviously not my original presentation. This is from Allison Hamilton, who is an investigator at the VA in Los Angeles and at UCLA. And she's really excellent. She did this cyber seminar several years ago, and it's been very well cited. So I'm using this because it's a great slide set, and there's no reason for me to make my own. Or else. Okay, so let me just go to slide 4, which is the first. Oh, I can't see the numbers of the slides. Okay. All right. So what I want to do is first to talk about why you would use rapid analysis, or what she calls it, rapid turnaround research. And that kind of encompasses the data collection and the data analysis. And so it's called a lot of different things. So it's rapid turnaround research, rapid analysis, rapid qualitative research. So all of these terms, it's not sort of put in stone, really. So we want to say, why would we do this? Think about how we would design a study to do it in a rapid fashion, and then just show the kind of steps in this process using an example. And I have a couple of additional examples. So the first thing is, why do we need a tailored approach for rapid projects? So, by rapid, it's usually, I don't want to get held up in a definition. So I will just say that when we do a full sort of coding, exhaustive coding kind of data analysis, and we use inductive coding, it takes a long time to do. And very often we are involved in projects where we need results much more quickly. And usually it's for projects that need actionable results. So for a project where, let's say you have partners and you need to report to them quickly, there are several sort of circumstances in which you need to do that. And so rapid analysis is, instead of a much more drawn out and in-depth traditional qualitative analysis. I think of it as sort of a continuum, though, that the rapid analysis itself can be more or less in depth. So this is what I just said, basically. So you don't have as much time, you need a product, and you also need to do it in a rigorous way, because you want to do a good job and you want to have valid findings. So it's not to say, oh, we're just going to read this really quickly and just come up with some results. It's still a very rigorous process. It's just a less time-intensive process. Okay. So why might you need this? I already talked a little bit about this. Let's say you only have funding for a year, or you have a deliverable that's due at a certain time. These are all, I don't have to go through all this, but these are all reasons that you might do a rapid analysis. Now, for the project, are you guys both going to be on the same project?
We're working on different projects.
You're working on different projects. So which project are you working on?
The EPOC project.
The what?
EPOC project.
You're in EPOC, okay, and you're in Michigan Medicine.
Mm-hmm.
Okay. So for EPOC, we're not really doing a rapid analysis. Maybe for the survey results we will. Hi.
Hi. We haven't met in person.
Hi.
Rama.
Hi. Oh, hi.
Nice to meet you.
Jane.
Sorry, I just wanted to come sit in.
Oh, wonderful. Okay. Yeah, so were you going to make a comment? Oh, yes. So for EPOC, we have done a very exhaustive coding. But I think I don't know how rapid analysis really comes into it, except that we'll probably use a matrix, which I will show you later. So just keep that in mind. And for Michigan Medicine, it'll be helpful if you tell me about the project a little bit and what has to be delivered when. What is the product?
Yeah. So in June, we're supposed to be delivering our report, which will have an environmental scan aspect,
Mm-hmm.
a focus group
Mm-hmm.
results
Yes.
section, and then a triangulation of the scan and the focus groups
Yeah.
and the quantitative data that's part of the scan
Right.
to come up with some actionable items.
Yeah. Okay.
And my understanding is that the rapid analysis is mainly focused on quickly being able to come up with some rigorous results from the focus groups primarily, but we're also doing some analysis on the KI interviews and the advisory board meetings.
Okay. All right, that makes sense. All right. So we'll just keep that in mind, keep that project in mind as we're talking, and we might want to talk specifically about some things. So you can just review this when, do you guys have a link to this Seger seminar? I think I'll send it to you so that you can have it. Okay. All right. I'm going to skip this one. Too complicated. All right. So rapid analysis is action-oriented, as we've said. You know, we are doing this because we have a pragmatic need for data, which is certainly true in both of these projects. And we're usually conducting it with a team. And we often are triangulating our results with other data. So that's true in the Michigan Medicine project and also to some degree in EPOC. And the thing about rapid analysis is you have less time to really reflect on the data, which you're doing a more traditional qualitative analysis. You're thinking about it, you're making connections, you're doing a lot of interpretation. You might do an analysis that's much more abstracted from the data or on a higher level of inference from the data. Here, you're really just not doing that much of all of that. You're just trying to get kind of, it's almost like just the facts, ma'am, kind of analysis. Okay. Let me see if we need any of this. Okay, all right, I like this one. So we have specific targeted questions and aims. So we first start with what do we want to know and be very clear about that. We have a prepared team, which I'll describe to you. Make sure that data collection and analysis is feasible within the time frame that we're doing. So these are all things to think about when you're designing the study, and very specific target products. So you kind of first start thinking about what is my product and kind of work backwards from there, really. Okay, so the thing about the data collection, and in Michigan Medicine, you're doing focus groups, which are usually fairly structured as things go. When you're doing individual interviews, you have more latitude to get less structured, meaning kind of following people's trains of thought and not sticking to this topic and then that topic and then this topic kind of discreetly. In focus groups, you can make sure that it's easier to make sure that you're asking questions sort of across focus groups in a similar order and to probe on each topic all at once rather than starting with a topic and saying, oh, we're going to start here and then follow someone's train of thought to another topic depending on how they talk about things. So the point here is that rapid analysis is easier to do when you start with somewhat of a structured data collection. So if everything on a topic is in one place rather than spread throughout a transcript, it's easier to do rapid analysis because you'll see that when we're doing rapid analysis, we're doing summaries of transcripts by topic that usually correlate to the interview guide or the focus group guide. And so it's easier to have a topic or a question on a focus group and be able to look at that chunk of data and summarize it and put it under that question or topic. And I'll show you this. But if it's less structured, then you have to look all over the transcript for something about those, each topic, and that makes it more difficult. So generally, when we're designing a study to do rapid analysis, we try to make the data collection what we call more structured. Do you have any questions? Okay. All right. This example is a Women's Health Services, VA Women's Health Services telehealth project. Telehealth is just a way to deliver health care through Skype or through some sort of remote way to do it, rather than having patients come in and seeing them in person. So this was a project about looking at how telehealth is working for women's health in the VA. And the people who did the analysis were actually 9 people with varying levels of qualitative methods experience. Some of them had no experience. Now, our team is not that big, and that's quite a large team, so they must have had a lot of data. So they did interviews with key stakeholders, et cetera. Right, okay, so they also did a final report, so it's very much like what we're doing in our projects. So the interview guide needs to be, structured or semi-structured, and not that long. I'm not going to go through these. It's too much to go through all of these. It's not helpful to go through all those questions. Okay, so I want to get to the part where we talk about how we analyze qualitative data rapidly. Okay. So, as we've said, it's a good technique if you have people working on it who don't have a lot or any qualitative experience. The data analysis is not, usually, if you haven't done qualitative analysis before, you might not, this might not resonate with you, but when we do qualitative analysis, we normally put tags called codes on chunks of data in the transcript, and then we put it in software and we say, give me all of the text with this code in one place. So we end up being able to sort data from all the transcripts across our data set into topics that we decide are useful topics for us to look at. That process, both developing the coding scheme and actually coding in an exhaustive way, takes a lot of time. So what we're doing is not doing that coding. Instead, we're going to be doing summarizing. So it's a different way of going about it. Also, if you do rapid analysis, it doesn't mean that you can't do a more in-depth analysis later. So you can do both. Okay. So let me go get back to this part, because let's look at the steps first. So how does this work? You've done the focus group. You have your interview guide or focus group guide in front of you. So the team does these things. First, creates a neutral domain name that corresponds with each interview question. So if you have the topic guide, actually I have something else on this computer that I wanted to use. But are you familiar with what a qualitative interview guide looks like? You are. Basically, what it looks like is it's a series of questions that the interviewer, it's a guide that the interviewer used to make sure that they cover the topics they want to cover and in what order. So the guide will have main questions, and then sometimes it'll have sub-questions and probes, and then it'll have another main question. And sometimes it's divided into broad topics too. There'll be a couple of questions under each topic. What this is saying is that if you have structured your interview guide in such a way, if you've written it in such a way that it's more structured, then you'll be able to say, let's take this main question and create just a label. What we're doing here, let me back up here. What we're doing is we're translating the interview guide or the focus group guide into a summary template to use to summarize each focus group or each interview. So that means that you want to structure the summary the same way across all of your focus groups or all of your interviews. That way you can look across and get the information on the same topics across. Otherwise, it's very difficult to analyze. So that's the whole idea of doing this. So those domain names, you know, what, oh, I think I can show you this. Hang on. Here we go. Okay, let me just show you an example of a, you might actually have an example on this, but let me show you our example. This was from a different topic, a different study. But we asked, the main questions we asked, this is just a summary on the top, but you'll see that this summary, that the whole document is divided into different domains. The first is a narrative. That's kind of a summary of what the whole of that participant. And you don't necessarily have to have that. But we asked about why they joined the study, what suggestions did they have to improve, et cetera, et cetera. So what you do is you set up a summary document, pretend there's no data in here, but you would use the same summary template for every focus group or every interview, depending on what kind of data collection you do. So all it means is that you have a document that's divided up into topics. And those topics correspond to your focus group or interview guide, the main questions. Okay. So you're creating a summary template to be used by the team. So the whole team will be involved in creating the summary template and agree on it. Then all the members of the team summarize usually the same transcript to see what the variation is in the use of the template and how the template might be changed. There's nothing like having contact with real data to make you realize, you know, things that you didn't realize before you actually read the data. And then you get together and you talk about it and see if there's any changes you want to make to the template. And then you divide, when you've done that, you divide the transcript up amongst the team, and then everyone does their summaries, which are structured all in the same way. And then the last step is transferring summaries to a matrix, which I will show you. So that's the process. The matrix is a summary, basically, of all the data you have in a very compressed fashion, and I will show you that. Okay. So this is what I just told you. Template summaries. Develop the summary, a relatively small set of predetermined domains, and they should mostly line up with the interview guide. Do you have a question? No? Okay. So here's the steps for doing that. So this is a good illustration of how you might translate questions on an interview guide with to a domain on the template summary. So are you aware of any services that are available to women via telehealth? So then you can say telehealth services. It's just taking the top topic that the question is about and naming it in a neutral way for the summary, okay? So that's pretty straightforward. And while I'm talking about this, remember that all of these steps can be modified and adapted to your particular project. This is sort of a generic way of thinking about it, but you might name the domains in a more elaborate way, or whatever works for your project. Okay. So this is what it would look like. You can see the elements here. It has who did the summary, if you're doing different sites, or it could be sites, it could be towns or cities, and who was the respondent. So if there's a focus group, let's say it's a focus group of fire chiefs. So you would say fire chiefs, if it's, whoever participated in the focus group. If you're doing a single person, then you would just put the role of that single person. And you can see here that the transcript, the summary is simply divided into the topics that are drawn from the interviewer focus group. Okay. And you should always include something called other at the end, because sometimes there'll be things that you think are really important but don't fit into any of the domains. And this is important, and it's also important for the team to keep abreast of what is coming up again and again so that everybody can capture it. So this is why it's important to meet quite often or be aware of this, or at least communicate by email and say, I'm seeing this, should it be another category? Okay. You can also put very important quotes at the end that you think when you're going through it are representative of what you're seeing and will be particularly helpful when you're writing your report, because you generally want to include quotations, actual data in your report to illustrate, to kind of support the points you're making. So it's nice to keep track of that as you go along. Okay, taking it for a test drive, I've described already. These are some of the things that you think about when you are using the template for the first time, okay? Are the domains easy to think about? Is it easy to find everything that is relevant to that domain in the data? Is anything missing, incorrectly labeled? Is it generally easy to use? And how long does it take to complete a summary of a transcript? Now, this says should take about an hour. It really depends on how long your data collection episode was, meaning how long is your interview, how long is your focus group. If you're doing a focus group, it's going to be longer. And the second thing that affects how long it takes to complete is how in-depth you want to go in your summary. So it really has to be discussed in a study team what the answer is to those questions, okay? And I'll show you an example after I'm done with the slides of something that's more elaborate than what you'll see here, just so you get a sense of the difference. Okay, so then you compare the summaries across the team, not just kind of what's there, but how it's expressed. Are you using bullets? Are you not using bullets? We want the data to be summarized in as consistent a fashion as possible across people who are doing the summaries. So how much volume does each person have? Use of direct quotes. This says should be minimal. That's also up to, the project itself. Are there notes regarding an absence of content? Are people noting when there is no content in that topic and why there might not be? And it's also nice to put notes like, this interview has a lot of data on this topic, or there are great quotes in this transcript, so that you know that it would be useful to go back to that transcript. So it's sort of a editorial comment on that transcript that might be useful later when you're writing a report. Okay. Okay. Now, in terms of how you divide up the transcripts among the team, you have to think about that in the context of your project. For EPOC, we're really looking at site by site, and we're looking at different stakeholders within each site. So if we were doing this for EPOC, we would probably take, and this is what we did, take the site and then divide it up. You have to think about the rational way to divide it up. You might say all the fire people, all the police people, all the EMS people we're going to assign to one person. So you have to think about what makes sense in terms of using, generally it's good to concentrate a particular role or site within one summarizer, because you get to kind of immerse yourself and know about that. So here is an example, just an excerpt of a transcript summary. And you can see in this case, there are very short bullets. And this is how they've chosen to summarize. This is I would say, it's kind of the minimum that you would do, okay? So brief. So what makes a good summary? Brief, again, no more than 2 pages. This is if you're doing a minimal summary. And I'm not using minimal in a derogatory way. I'm just using it as sort of the marker for kind of minimal, literally. The summary should be as brief as possible, let's say, organized in a systematic way and the same way across data collection episodes. Thorough in terms of you need to capture the main important points from the transcript, readable, and useful. I would say both in terms of pointers for what's in the transcript, as we just discussed, but also useful in terms of the content. Is this content useful for the purposes that we are using it for? Okay, this is a very detailed slide. It's not really meant to be, I'm not going to present it, but it's a good thing to go back to when we're actually going to be doing a project and go over these topics. Okay, so they're in the slide set, and we can, when we are actually doing the project, we will review them. Okay. Okay. Now this is when we get to a matrix, which I think is, I always use matrices for projects, whether it's rapid analysis or a more traditional qualitative analysis. And you'll see why. What it allows, let me see if she's got data. Let me just show you generally what it is as an illustration. So basically what a matrix does is that it summarizes each data collection episode for each topic that you've included in your summary template. So obviously down the left side you have interview 1, interview 2. This might be focus group 1, focus group 2, etc. And then the topics on top, in this case it was about telehealth in women's care delivery in the VA. So these are the topics. There are 3 of the topics that they were looking at. But in our case, we might, talk about equipment or response time or, whatever the topics are that you really want to focus on in your analysis. And also, these should reflect also, as much as possible, what you want to report. So when you're setting up your focus group guide and setting up your summaries, you should keep in mind what you want to report, what topics you want to report. It's not always a straight line from these topics to how you organize it in a report, but they at least need to be useful to you in terms of writing the report. Okay, so you see this sort of, basically what this is that the summaries are short enough, and I think what she's done here is just taken all the data in the summaries and put them in these boxes. If your summaries are more elaborate, you need to summarize the summary, okay? And it can be, I'll show you another example, but it can be also numbers. It can be, you can get together and say, we want to rate this as present or not present. You can put yes, no, you can put small, medium, large, you can put kinds of those sorts of things also. But the idea is when you have this, you can then look at your data and it's all there. Even though it's in a very summarized form, basically you've captured what's in your data. Obviously not in the detail that it actually appears in your data, but at least it's a summary of all your data. It allows you to look down the column and say, what did everyone say about telehealth? What did everyone say about PACT? And it's so useful to be able to just look at it and be able to summarize. You can also order the summary, let's say for, we might have, let's see, let me see how to put this for EPOC. You might order EPOC by type of stakeholder, let's say. Let's say you've interviewed 2 police people and you've interviewed 2 EMS people or whatever. So you might want to order it by stakeholder so you can see the differences across stakeholders easily. If you end up with a site summary, which is a whole other thing, you might order it by high-performing versus low-performing sites. So then you can look at patterns in the data. Did the high-performing sites seem to be different than the low-performing sites, and how? Okay, so it lays it out all in one place so you can really look at patterns in a way that you can't look at it in other ways. So let me go back up here. So you're transferring the summary points into the matrix. And this is all just quotes from people that basically say what I just said. Okay. And so this is the ordering. So you set up the matrix that makes sense for the purpose of the analysis. So think about the ordering of your what we call cases. A case in qualitative research is a generic term for data collection episode or also unit of analysis. There's different, but basically what's in your rows. And there's the matrix. And so this is what you can do. You can look at either, so this is what I said, when you look down the column, you can see what's in that column. Is there variation? Is it all alike? Are there things we didn't find out? Also, what you can do, which is really useful, and this is when you're really developing findings. A memo here means just your thoughts, basically. A memo is just your thoughts. So you can look at it and say, oh, I'm seeing this pattern. Or you can summarize the domain and say, this is what I see in this domain. So you're then writing prose based on what you're seeing, basically. Okay. So this is kind of a summary of what you can do with rapid analysis, which is pretty clear, I think, after we've talked about it. But you're dividing up the labor, so not one person is doing all the work. You're looking at data collection across the team because you're really assessing summaries early on, at least, and you can do quality control as you're going. You get a quick understanding of major findings. which is really what we want to do. And you can also do this, it's recommended really to do it during data collection so that you can get an understanding of your data and use that understanding for future data collection. Obviously, we prepare reports and presentations. And if you want to do a more in-depth analysis, traditional analysis, it's also a good basis from which to develop a code book to exhaustively code the data. So this is just a sample slide from the presentation they did from their rapid analysis. Okay, so that's the end of the slides. I will give you a couple of other examples, but do you have any questions? Are there any kind of applications that you could imagine, or are there any, I don't know, I want to know if you have any comments so far. Is there anything surprising, or go ahead.
And I'm sorry if you said this
Yeah,
before I
please.
walked in, because I know this is late.
No.
At what point, I know that you mentioned at the outside when you're designing a study, you're sort of talking about more traditional qualitative analysis versus rapid analysis.
Yes.
How do you make that decision up front?
Oh, good question. Well, you always have to think about what's the timeline of your project, how much time do you have, and what are the products. Okay, that's number one. Number two, and what are your resources? Okay,
Sure,
so those are three. The other thing is, what I mentioned at the beginning, is that this is and I think I mentioned it since you're here, that this is like a minimal form.
Right, and you mentioned that
so
you
there's
go on to
kind
do
of
other things.
you can go on to do other things, but you can also do a more elaborate form of this by making summaries more elaborate. So you can go into more depth than is shown here. And it's still sort of a rapid analysis because it takes less time than coding all the data exhaustively. So I don't think of this as one thing. It's a basic framework technique, but your summaries can be more or less in depth.
Yeah. So it's perhaps
it could be like a midway.
Yeah, it's on the spectrum.
Yeah.
Got it.
Right.
Fair enough.
So it just depends on, you have to take all those things into account. And also for your topic, what's going to be useful? If a rapid analysis is not going to, if an analysis that we've just seen is not adequate for your topic, then you shouldn't do it. It really depends on what you're trying to do. Okay? Okay. Anything else? Have you done traditional analysis or any analysis?
So I was briefly in a number of different things. I have a master's in quantitative research,
okay.
Exposure to qualitative stuff, so I wanted to come sit with them because it's not something that I know
Oh,
about
okay.
at all.
Okay.
So my qualitative stuff is very intro.
Yeah, great.
So
You should come.
taking the time to do this.
Oh, absolutely. If you can, we have twice a month, we have something called the Qualitative and Mixed Methods Learning Laboratory.
Oh.
And we have methods topics, and the first session of the month is methods topics, and the second is works in progress, where people come with their projects and we talk about it and give advice. So if you'd like, I can put you on the list for that, all of you. So, okay, so I'll do that when we're done. So let me see what else I wanted to show you here. Yes, I wanted to show you a summary that's a little more elaborate than what I just showed you. What we did in this project, it's about access and continuity in academic primary care clinics. I won't get into the topic, but you can see that we have these different main topics that we've divided our summary into. This is just a part of it. Site demographics, resident model, resident integration, walk-in, between visits. Okay, so these are all topics. What we've done here, instead of the bullets, is that we've taken, first of all, our interviews were a little less structured, so we needed to look at more of the interview than, we didn't design it as a rapid analysis per se. So there was data a little more spread out across the interview. But what we did is we looked at, each person the person that was assigned said, okay, what do I see in this transcript about walk-in? And then the analyst would find that data. You end up kind of coding anyway because you sort of see it in the data, but it's not the same process as coding. So you look at all the data in the transcript about that topic, and the analyst will summarize it, and then put one or two quotes that really support that summary. And it's a little more elaborate than the bulleting. So this is just another look at how you can do summaries, other than bulleting, and that can be a little more elaborate than bulleting, or a little more in-depth. So let me just read one of these. They've assigned residents on opposite blocks to get residents to be more responsible for covering for each other. Some residents who have home access, blah, blah, blah. So it's a summary of what is in this transcript about this topic. Okay. It's the same idea, but you can see that summaries can be, it doesn't always have to be the same format or the depth, the degree of depth. But in this topic, I didn't send this over to Sydney, but we did make a big matrix for this project with all the sites that we interviewed and the main topics, and it was very, very useful. But I hope you can see how this process really allows you to get to findings pretty quickly, and that's the idea with rapid, that you can look at it and say, yeah, a lot of people said this, some people said that, there's variation here, there's no variation there, etc. So that's really what I have to show you. Are there any other comments? Okay. I guess that's it. Thank you. I'm going to stop sharing. Now I remember that I'm being recorded.
I'll cancel the call.
All right, thanks.